Hello, we're Team Code Blue, and for our EBP project, we wanted to screen women for substance use. We found that substance use is a growing public health concern and that pregnant women are especially vulnerable due to the stigma and shame associated with this. We feel that a conversation about this should occur early on in the mother's prenatal care. And some factors that we found that delay their seeking of treatment include the fear of judgment or stigma associated with this, fear of prosecution or removal of the children by the state, and the economic hardship or lack of child care available to them. Some adverse outcomes of maternal drug use, or substance use I should say, include low birth weight, miscarriage or stillbirths, fetal alcohol syndrome, neonatal withdrawal, or other cognitive defects. So our objective for this project was to increase the communication between providers and pregnant women about their substance use during their first prenatal visits. So in order to get some information about this, we looked at a primary research article, some general review articles, and then expert opinions to work towards this quality improvement.
So potential solutions found in the research included contingency management, which is using positive reinforcement to try to change behaviors. We also looked at motivational interviewing to find out what motivates the women to change for the better. And cognitive behavioral therapy, which is changing how you think about what you're doing. Providers also use self-reflection to identify any potential biases that they may have towards this population, because it's a very sensitive issue and people have mixed feelings about it. But the most effective intervention that we found was the use of a screening tool. So we would screen all women, not just suspected users, for potential drug use or substance use. And we want to create a trusting environment so we can increase communication between the provider and the pregnant women. So this study was to be piloted in one OBGYN clinic in the community, and we would use a standardized screening tool to prompt all providers to ask all women about any substance use at their first prenatal visit. So to monitor our results, we would use a questionnaire at checkout for every woman that just had their first visit to see if they were asked about substance use. And then we would conduct daily quality checks to determine if those forms had been filled out and filled out thoroughly. We would use a Plan, Do, Study, Act methodology to evaluate how we're doing. So every 2 weeks we'd look at our data, see what was going well, what wasn't, and change what needed to be changed to get better results. The ultimate goal is to increase the use of the form to increase communication between the provider and the pregnant woman. And ultimately the goal is to increase the use of this form by 90% in 3 months so we can decrease substance use in pregnant women.